Kevin Casey, I'm the president of Rochester General Hospital.
Hi, I'm Kristin Opett. I'm the Vice President and Chief Nursing Officer for Rochester General Hospital.
I will send you spellings unless you want them to be spelled right now. How do you guys spell your names?
Yeah, that'd be great, just so we have it on camera. Thank you.
It's Kristin, and the last name is Opett.
And it's Kevin, K-E-V-I-N, Casey, C-A-S-E-Y, and M-D.
B-O-B, D-U-F-F-Y.
Everybody ready? You just toured there?
Yes.
Is that your first time in?
I'm probably in there about every 3 days.
Yeah, okay, so it's not your first time. I had an opportunity to show it off today, though.
What's the
Right.
latest update you can give on it?
Well, it's, the building continues to make great progress as we go through it. Every time I go in, I see changes in it. The building is being finished from the basement up, and so as you go up, you see a little bit less, but you see more and more each time you go in. The operating rooms, which are on our second floor, have the walls and structure built around them. Some of the equipment's actually beginning to be installed in those rooms. The blanket warmers are now being installed in those. You see some of the cabinets going up in those rooms. The project is on time with an expectation that without anything that gives me any hesitation that we are going to be cutting the ribbon for it the end of September.
And we're here to talk about the impact on the community, right? A little bit. What are you expecting when this all opens up here?
So this is, for Rochester Regional, the biggest project we have created. It's a $250 million construction project. Coming online, it will give us 132 variable acuity rooms. It will give us 23 new operating rooms. With that, we'll see between 200 and 300 additional employees coming on our workforce. All of that has a huge economic impact on the community. The construction alone is it's one of the biggest construction projects in town. This is very significant economically for the community, and the contribution to jobs, healthcare being our biggest employer in town. It is significant for what it delivers on the economics as well as the healthcare impact of it.
As a layman, I would say it's an amazing building. We were here for the groundbreaking, but as Dr. Casey said, it really is going to be transformational for healthcare in this community. It is just fabulous to walk up and see what is there. And as the doctor mentioned, 300 jobs, $260 million or so construction project. I want to give a shout out to my board chair, Rob Sands, the Sands family. Donated $20 million back, I think, 2017. So you have great private sector support. I think the state is north of $10 million on this as well. So it's a great collaboration, but it is beautiful. I want to give a shout out to the Chase Construction. To see these men and women up there, you have to have a great sense of pride for what is going on in this building. Just phenomenal construction. Mike just gave us a tour. Just to see the depth of planning between the construction teams, the healthcare and medical teams, it is going to be a state-of-the-art facility. And I just close by saying Rochester is, I believe, has the best healthcare per capita of any place across New York State, probably across the country. Thanks to the systems we have here, thanks to great medical expertise. And this is just going to add to the reputation of this community when this is done. It is fabulous. It is a major construction project, but I think as we talked today, with all the new operating rooms, I think Dr. Casey said they're all going to be going from the time it opens up, so it gives you a sense of the needs for healthcare here as well. So we are just so proud of Rochester Regional, the team, the Constellation Brands, LaChase, or I was the Sands family, not Constellation Brands, but the Sands Family Foundation, and LaChase, and all the people working here and being a part of it. It is, to me, just an absolute jewel.
As Kristin just to comment on our nursing workforce and the impact of this for our nursing
This
workforce.
is really going to transform the way that nurses are able to deliver care. The rooms themselves are enormous and so much bigger than we can deliver the care today. They're all private rooms. They will allow for variable acuity, so whether it's an intensive care patient or a more normal or acuity patient, we can care for them. Really, every single detail, we talked about it while we toured, from supplies right near the bedside to allowing our families really to have space in the rooms to spend the night with their loved one in privacy with just their loved one. Truly, truly phenomenal for our nurses. It will add about 100 nursing jobs, and so that's something that we're working really hard to accomplish. And really every single day we're training and simulating how we're going to flow in the new arena.
Rochester being known as top in healthcare, really recognized in so many different areas of care. Do you see this project obviously as an extension, but also just the impact, maybe what you were just saying, for families and the quality of care, knowing what they have here in this particular institution?
Hospital has been designed and built with a view to the future throughout. It's not being built for 2020, 2021. It's being built for the next 20 years, the next 30 years. The room sizes, the technology that's being incorporated into this enables us to be able to anticipate those things, adapt to those things, and add those to this structure. It really is unique, and moving from what is the legacy structure at Rochester General, it gives us a much greater flexibility and will act as also an enabling project to allow us to do the things we need to do in our existing structure. And so there is a phase 2 to this, a phase 3 to this, which is really what happens in the legacy RGH, and that too becomes a significant economic investment as well.
Every inch of the building is really centered on the patient, their family, and the team. We've really accomplished what we need to do for all three groups in one space, and it's quite remarkable.
I would say it's the planning. I was blown away by the collaboration again with the medical and health professionals, construction, I'm sure patients. It is really, it's a futuristic look at a hospital. I just was blown away with the construction site. You can get a sense of what it will look like when it opens up. It will be fabulous in September when it opens up. And I think it's going to be just a jewel for Rochester, and again, just kind of adds overall to the reputation of our healthcare community. But again, I'm going to go back to the construction. I'll give LaChase another shout out. The skill involved, the planning, what they are doing up there, you have to walk through and see it to really appreciate it. And for all those men and women every day to come in here that have jobs throughout the whole construction phase of this building, it's a great economic impact. And I would venture that when the building opens up, we'll have patients not just from Rochester or this region, they'll come from outside the area. So the economic impact even coming in, people will come here for medical care, for surgery, and so I think overall it's just one huge boost, but also just reinforces where Rochester stands overall with our really super high level of healthcare excellence.
Dr. Bob was just mentioning coming in, we'll be able to attract more doctors and specialist type things, and maybe talk a little bit about that. And also I was just wondering, when will you be looking for these employees to begin to apply for these jobs?
We've already started. That process was already turned on because it is a significant lift to find 130 new nurses. It's a significant lift to find all the other folks that we need to work in this building. Health professionals coming out of training look to practice in facilities that offer them the ability to do what they want to do and to be able to have the technology to work with. This building is a very strong statement about us being able to provide the environment for them to be able to do that. We have been very fortunate in being able to recruit excellent providers. This simply adds to our armamentarium of being able to do that and be able to provide the facility and the technology resources for them to be able to practice in a way that they expect to practice.
You mentioned the heavy lift for the nurses. Is there a concern that maybe it might be difficult to be able to fill that many positions, and where are the applicants coming from?
So this is really a large-scale effort, and it's an exciting time. This is the first time that a year has been named after a profession, so this is the year of the nurse and the midwife, 2020. So it's very appropriate that our new building is opening up as such. So this work has been going on for quite some time. So we're recruiting both locally, but more regionally and nationally as well. I'm working with our local schools and the chairs of those departments. Tomorrow, for instance, I'm touring chairs from local schools through the new building. We've set up student tours, and so it's really creating a sense of energy and excitement both within our local and national market for nursing. So we're doing things different than we've done them before. We're also bringing LPNs back into the mix in acute care. That's more commonplace across the country. It's not just here that we're doing that, but we're looking at how can we be really efficient in delivering high quality care and changing some of what we do. And so we've been doing this for well over a year now in planning.
Are you confident there's enough qualified
Yes.
nurses to fill those spots?
Yes, I am.
So you say you're on time and everything is working out well for you.
End of September?
September.
End of September. And to that, I really give a tremendous applause and thanks to the LaChase team. They have, I'm looking at our boss over there, who has been absolutely exceptional in in running regular tours through here, but also keeping this project moving forward. The crew is working 7 days a week in there. I'll come in and do a tour at 4:30 in the afternoon and finish up, and there are crews that are coming in then to do work. They have really done a heroic job in getting this project.
When did construction start officially again?
Fall of 17.
Fall of 17. Thank you.
What about the equipment? There's gonna be a lot of equipment going in here. Anything locally that we've been able to, have we tried to buy US
From-
brand kind of thing, or have we looked
Yeah,
at that?
Absolutely. From our signage that is coming from the Rochester area for the building, for the signs that are gonna be our locator signs, those are coming from a local company. There is our nurse locator system that we use is over on Ridge Road, so about as local as you can get for this hospital. There's a tremendous amount that we source locally that supports local jobs in the market here besides just construction, but other things that we bring into the hospital here. So yes, there is a lot that we do in the technology that we incorporate, the trades that we incorporate. The skills that we bring into the hospital here really depend on this local economy.
Have you been able to put a money number on how much of an impact it has here on Monroe County?
While the building itself is that $260 million number, the labor contribution, this is well over an 8-figure, nine-digit number on that, on a annual basis.
I would agree. As a former mayor, each dollar turns over 4 times in the community. So you multiply that by 4. It's cars, clothing, services, and I think of all the construction workers around the clock are working. I think we'll measure that toward the end, but as the doctor said, it's a fabulous economic impact here. And my sense is this building will be an award winner when it's done. It's going to get a lot of attention, not just here, but elsewhere.
This hospital is about $1 billion enterprise, top line enterprise a year, so it makes a huge impact on this community.